Our resident services team took a leap of faith. We decided to bring pharmacists in from Kelley-Ross, and it's been proven to be very successful. Our residents now know the difference between going to their doctor and talking with a pharmacist, and the benefits of both. Kelley-Ross has been so wonderful, and they are allowing us to accomplish our goals of bringing services to our residents so that they're able to age in place, and approaching that with a very holistic view of medication management, fall prevention, and the whole gamut of what that actually means to age in place.
So I'm not a doctor. I didn't go to school to be a doctor. I haven't trained to understand medications or serious side effects to general health problems, and especially specific health problems. However, my residents come down all the time and say, I'm experiencing fatigue, I have this really weird pain in my arm or my back, or I feel really foggy and I can't think straight. These are things that I'm responsible to notice and look out for, but I can't help people when they say, I think these drugs are making me feel weird. I say, talk to your doctor about that. And getting to the doctor is hard, making an appointment with your doctor is hard if you don't speak the language. And so having a pharmacist come who can spend a whole hour with someone using a translator, listening to all of their side effects they're experiencing, looking at all their medication, that gives me such peace of mind. We as a team took a leap. We went out there and we decided, let's just try this. No one really is doing what we're trying to do with bringing a pharmacist in. Let's just see what reaction we get. So we kind of took a leap of faith, and we were really pleased with that. So we had wonderful collaboration between the pharmacist and our resident services team. We had a really nice point person at each of the buildings that helped market and educate the residents on what was coming in. And then the Kelley-Ross pharmacists also came in and held presentations multiple times, focusing on the bigger picture of what medication management is, and then also on more specific issues that residents might relate to, pain management, diabetes care, that tied into managing medications. So we did a lot of outreach with our residents to introduce them to the pharmacist and to the idea that maybe with these types of issues, it's best to speak with a pharmacist than go to your doctor, and transitioning them to this new way of thinking that we decided to jump into with this pilot program. It would be amazing if my colleagues, not only in Seattle but in other places, because I know that this isn't only a Seattle area issue, could have pharmacists who are able to talk one-on-one with residents, make sure everything is okay, and just help people sort through their health issues in a way that is personal and accessible.